Okay, it's my great pleasure to announce Thomas Parr is about to present. So Thomas is one of those special people that manages to be essentially a full-time researcher at the same time a full-time clinician. So both medical doctor, or he's a doctor basically. Or maybe, and so he did his PhD at UCL and has now, as a newly minted member of Oxford University, and we're very happy he's there. And take it away.
Thank you very much.
I'm muted here. How do I? Sorry, Thomas.
No, go ahead.
Okay, no, all good.
Yeah, all good. Great. Well, thank you for the introduction and for having me here today. So, as James mentioned, I have both a clinical side and a research side to what I do, and this talk is designed to try and merge the gap between those two things as best as possible. So I'm going to talk about models of brain function and how we tend to think about that, and also think about how that can be used to understand clinical conditions. I'm going to do that largely using a framework known as Active Inference. And I always like to start presentations with this slide, just to emphasize a key point for that for everybody. So this is a very famous visual illusion known as troxler fading. And the idea is that if you fixate on the center, on the crosshair, and maintain your gaze there, gradually you'll see all the surrounding colors fade away. And when you start moving your eyes around again, they will appear again. And the reason I like to show that is that I think it's a really nice illustration of the importance of considering action and perception together, that dealing with one on its own always misses something. And you wouldn't get the full sense of what's going on with this sort of illusion if it weren't for the fact that you're moving while you're viewing it. So the broad structure of the talk, I'm going to go through in several different parts. So the first part will just be talking about the idea of brains as modeling the world around us. That's something that's probably familiar to most of you. I'm going to briefly talk about certain kinds of generative model that we might use, or that our brains might use to understand the world around us. And we'll have a think about how that relates to things like anatomy and microcircuitry. And then finally, I'm going to go through a series of different pathologies of inference. We may not have time to get through all of it, but we'll see how much we can do. And I've split that out in terms of different parts of models that can go awry. So our prior beliefs about the world, our likelihoods that explain how the latent states in our world generate the data that we observe, and then thinking about hierarchical models and empirical priors. So I'm going to start with this topic, self-evidencing and inference. And the key idea here is based upon, it's sort of illustrated in these graphics. So you can see two different sorts of stochastic system, exactly the same amount of noise put into both. One of them maintains its form over time, whereas one becomes progressively dispersed over time. And the reason I like to show this is because biological systems will be sort of more like the system on the right than the system on the left. Their dynamics will be such that they can actually maintain a form over time. And we can re-express that explicitly in terms of the density dynamics of these kinds of systems, at least for simple kinds of systems. And here you can see something that completely loses its form on the left here, and another system that maintains its form over time on the right. So the question is, what sort of dynamics do these sorts of systems have to have? And the answer is that they need to have the sorts of dynamics where they can be seen to be climbing the gradient of some steady state distribution. So you can see here, although it's being pushed away in all sorts of different directions based upon random fluctuations, this system is maintaining its form by climbing back up the probability gradient and therefore maintaining this sort of static distribution over time. And we can sort of express that relatively simply in this equation here. The next step that we need to think about when we're dealing with biological systems and systems like the brain is that there are several different parts of the system that are relevant. There is the environment and the world out around us. There are the things that we use to interact with that environment, whether that be our sensory receptors or our muscles. And then there are the internal states of the brain. And often we think about how we separate out this distribution or how we factorize it in terms of a concept known as a Markov blanket. A Markov blanket is just a statement of conditional independence. It just says that conditioned upon one set of states, here this is going to be our muscles and our sensory receptors. The outside world and the inside world are conditionally independent of one another. In other words, our interactions with the world are via these different states. And just showing that up here, you can just about see above the camera image at the top. So the idea being that our external states here, eta, are independent of our internal brain states mu, given our blanket states b. And we can express that in terms of a steady state that can be expressed here in terms of a factor graph. I'm going to talk a little bit more about those in a moment. And then we can write down the sort of way in which distributions then evolve over time as a consequence of their initial conditions as they head towards this steady state. And so here I'm just showing again some simple dynamics of a system with some arbitrary initial state as it evolves towards some steady state. The key point, and I'll show you again in terms of the deterministic density dynamics, but the key point I want to emphasize about this is that if you look at this plot up here as it arrives at its steady state, you can see that there is actually a probabilistic mapping between what's internal and external, and that's determined by the interactions through those blanket states.
Each dot is what?
Each dot is just a different realization of the simulation. So effectively, the density dynamics we're seeing there are effectively the deterministic limit once we've got a large enough number of samples. So coming back to that, so we've got our idea of a Markov blanket, and we've got the idea that we're sort of jointly maintaining this steady state with our world. And we can see that by sort of picking out the individual elements of this this gradient descent. So we can say the internal states of our brain appear to be climbing this probability distribution. We can also make a change of variables. So here we're just defining this bold eta as being some function of our internal states. And we can treat that as if it's a belief about what's going on outside in the world. All we've done here is just a change of variables, and it's really nothing more than that. But the interpretation we can now put on that is as a generative model of the world. It may not be an accurate generative model, but we can now factorize this, this joint distribution of our external states into a prior belief about external states and a likelihood of the blanket, so the sensory or active states dependent upon those external states. And we can treat this as a model that this system is effectively trying to optimize. Just show you a simple graphic. Yeah.
So can we think of B as a sensory input?
Yes, exactly. Yeah. So B would include both sensory input and any actions we're taking. So both muscles and muscle states and the state of sensory receptors.
And when you're saying state, you'll find a state of something, or
some variable in the world, essentially, or some variable in our brain.
But it's complicated because of time, in the sense that, given the sensory input muscles, my internal state is still massively happening outside world.
But only via those other things is the key point.
In addition, on the whole history,
yes,
if you can listen on a particular time,
so I'm
previous time.
That's certainly true, and I'm glad I put this slide in with these details. It's borrowed from another talk, but and you do get these sort of transient couplings between internal and external as the system evolves towards some steady state. The idea being that the eventual state that you may or may not reach in reality would be one of independence. The other key point there is that you don't have to define these states as simply being the current position of something in the world. You could also say, well, it's the position and the velocity, or it's the position and the velocity and the acceleration. So by including increasing orders of motion, you're effectively representing trajectories at that point. And then because the flows are uncoupled, it means that the trajectories themselves are uncoupled once you take into account the trajectory of the blanket state. So that allows you to account for an element of the history. It is a good point. So all I'm showing here is a representation of the evolution of 3 different variables, but I've now added in this distribution that we can interpret as being beliefs about the external states, which are purely a function of the internal states of the world. And you can see that they tend to, not always, but they tend to align relatively well with where the external state of the world is. So that sort of is to motivate the idea that we can think of the way our internal states in our brain are evolving as optimizing some probability distribution or climbing some probability gradients. But then the next thing to think about is how we actually generate actions, how we then interact with the world around us. And yeah,
a statement about how the brain works or hypothesis?
So at this stage, it's just saying that if we have some system, and we can sort of argue about whether or not the brain complies with that, but if we have some system that has, approximately speaking, some steady state, then the dynamics of that system will look as if they're climbing probability gradients. If we then separate that system out into inside and outside, which is a key part of neuroscience that doesn't necessarily apply in some other fields, then we can start to interpret under some change of variables the dynamics of what's inside as being beliefs about what's outside. So at that point, I wouldn't necessarily call it a hypothesis, although there is a reasonable question as to whether that then applies to the brain. Does that answer that question?
Not exactly. I mean, well, let's go.
Should we come back to it later? So we've been talking about the sort of sensory states and the active states of our body as also climbing these probability gradients. And one way of interpreting that is in terms of a reflex arc. And so here we've got our sensory data or proprioceptive data, Y, coming into our spinal cord, our active states, our muscles changing the world around us and creating this loop. Can you actually see my cursor? You can, good. And what I'm showing at the bottom is just an interpretation of a probability for our sensory data, which can be interpreted as like our steady state from the perspective of our data, but now interpreted as if it is the evidence for some model of the world. So here we're now just breaking that out into two parts, as if it's a marginal likelihood, a model evidence, and interpreting that in terms of the accuracy with which we're predicting some data, and the complexity here being how far we're deviating from some prior beliefs about the world around us. If we're now trying to maximize this evidence, if we're trying to essentially fit our model as best as possible to the world by actually changing the data we're getting in to improve that fit, we can now interpret this, because this is the only term, or because this is the main term in which data has a role, as trying to maximize the accuracy of our predictions by changing the data itself. And we can interpret that very much like a reflex arc. So here is just a simulation using these principles where we're injecting a little bit of additional sensory input into the biceps tendon, which then creates an error. So essentially an unlikely sensory input based upon my current model of the world, which is then corrected by moving towards a more likely position based upon that error, which here is the generation of this reflex. So we're introducing an error. That error is resolved by moving my arm in such a way that I try to reduce that, which is what we'd see with any healthy person if you tap on their reflex. So the basic idea here is that now we've equipped our model of the world with the capacity to change the world around us. And so we can correct any deviations from the predictions of this model by acting on it. And that looks very much like the sort of spinal or brainstem reflex arcs that we might see in the nervous system. So the next thing I'm going to go through is just the structure of generative models and how we tend to present those models. And much of that will be familiar to lots of people, I'm sure. So the idea again is that we're treating this steady state distribution that we're trying to climb the gradients of as being like a model evidence. And we can do that by saying that this distribution, my cursor there again, so this distribution can be interpreted as the marginal of some joint probability distribution that makes up our model. So we have a number of latent states that are now causing our data. We can then factorize that model in various ways, assuming that the model has some degree of sparsity to it. And we can use that to provide quite a nice graphical formalism that gives us a good sense of what's going on. And I've shown you a couple of examples of this already. So for instance, if we take this distribution here, our likelihood, we can represent that by a box which represents this factor and connect it to the relevant variable nodes that it represents. So here the conditioning set feeds into the box and the output is what's on the left of the conditioning sign. And then we can do that for all the other factors of our model, and we can build up a sense of how our data were generated based upon the sequences of steps that we'd have to make. Yes, and what I was just going to show you on the next few slides, probably something that's familiar to lots of people, but you can look at a number of common models that we implicitly use in this formalism. So principal component analysis, where you have some low dimensional space that you're projecting to some high dimensional space, the inference being trying to recover the dimensions of that low dimensional space. Similar things with things like canonical variance analysis, where you're predicting two different sorts of linear combinations. Even clustering analyses, where you start with a probability distribution over one of several discrete states, and from that generate different, sort of, in this case, Gaussian distributions. So what I want to do next is use the idea of a generative model, and specifically a sparse generative model, and the concept of a Markov blanket again. But here I'm going to use it in a slightly different way. So if we take a generative model of this sort, we can identify the Markov blanket of, say, the x2 variable by finding the parents of x2, so the things that are causing it, children of x2, so the things it causes, and the parents of the children of the things it causes. And so once we take all of those things into account, that's all the information we need to know about the other variables in the model to tell us about x2. We don't need to know about all of the other things that are outside of this Markov blanket. So essentially we could ignore everything else. And that's quite useful in terms of developing inference schemes. And one example of an inference scheme would be a scheme known as variational message passing, which is here represented in terms of a gradient descent just for biological plausibility. There are lots of other schemes that we can use for the same sort of thing. But the key thing to note is that we only need to take account of the parents here and the children here, and of course the parents of the children, in order to get the information we need to update our beliefs about whichever variable we're interested in. And we can recursively represent a series of loops here that perform this inference or this inferential process. The graphics here are supposed to show, so the epsilon signals are essentially the gradients of our objective function, which is here our marginal likelihood or a free energy approximation to it, with the V's representing the beliefs that we currently hold about whatever we're dealing with. Putting together what I've shown you on the last few slides, this is just saying that we can then start to map the message passing schemes that we get out of the right sort of generative model. And so this is an example of a generative model for ocular motion that essentially just models the Newtonian physics of how the eyeball might move around. We can then map the associated message passing with the reflexes that then make changes in the world to anatomical structures. And by putting in the right priors, we can then generate movements of these different sorts of systems just by fulfilling these low-level reflexes. And here you can see just a different prior belief in place about how I'm going to move my eyes around. So the next step, which is key for a lot of the sorts of models we deal with, is the idea of planning and of dealing with sequences of events that happen in time and choosing between those. And this slide is just designed to show that certain sorts of continuous dynamical systems can be interpreted as a set of sequences and a sequence of events over time. So all we've done with this dynamical system is we have some continuous orbit, which is mapped through a softmax function into effectively probabilities of different sorts of state that are visited at different times, and mapped each of those categorical states to different attracting points in some dynamical space so that we can then generate more complex sequences. Effectively, that means that, sorry, there's the cursor again. Effectively, that means that we can now represent a sequence of a motor trajectory in terms of the sequence of states that I visited in order to enact that trajectory. And we can think about different sorts of sequences as being different policies or different plans that I could then pursue. So here you can see the difference between the pattern that we followed here and here, simply by changing the sequence we visited each of those attracting points. That then calls for a prior belief about how we're going to select between these alternative sequences. And the prior belief we tend to use is one that they will minimize an objective function referred to as an expected free energy. And this effectively breaks down into two parts, one of which is saying how much information will I gain by taking this action? How much will my beliefs change from where they are now to where they will be after I make an observation? And an extrinsic value term, which is essentially saying I have a set of preferences in a distribution that is acceptable to me. And I want to try to match my beliefs as closely as possible to that. Sorry, you're going to have to help me find it again. I want to try and match my beliefs as closely as possible to that distribution. Effectively, what that means is that we have both exploration and exploitation, the idea of seeking out information, but also acting to get the sort of data that I want, combined into a single objective function. And once enough of that uncertainty is resolved through information seeking, I will then just pursue whatever goals I had in mind. So this slide is just showing an example simulation of a simple generative model. So here we have pi being the choice of sequences we're going to make in terms of where I'm going to make a saccadic eye movement. The S's, so S at t-1, t1, t plus 1, are the different fixation locations I can choose. And they also include information about the different states of the world. And this world is a very simple world that essentially has 4 different locations I can look at. In each of those locations, there is a different shade that can appear, and it can change with a certain degree of randomness from one time step to the next. And by choosing policies that minimize that expected free energy, maximize my information gain, I end up with a relatively even sampling of each of these 4 locations. But just to give you an intuition for what happens when we manipulate that, we can see here that in this one, we've got exactly the same simulation as before. In this case, what we've done is we've reduced the reliability with which data are generated at that location given the latent state. So essentially, we've made it more ambiguous. The likelihood is now much more uncertain associated with that state. Because that's now more ambiguous and less information to gain from it, because it's just noisy data, you can see our simulation chooses to look there much less frequently because it stands to learn less from that location. In this lower plot here, we've sort of done the opposite. So we've now made the uncertainty over the dynamics much, much higher in this location, so in the upper left. So it's now much more uncertain, given when it last looked in the upper left location, about what it will see if it looks back there again. So there's always more information to resolve by looking back to this much more volatile location much more frequently. And that's just designed to give you a bit of intuition for what happens when we put these sorts of information seeking terms into our objective function. And just for completeness, this is a simulation of the same illusion I showed you at the beginning, using those principles so that it can move its eyes around to look at the different locations versus one where it's fixed. And you can see the gradual fading away of the percept in this case as it fails to move its eyes around. So that was a very quick sort of overview of some of the key principles and some of the ideas that we tend to use. And the next thing I want to do is actually show you some specific models that try to address particular kinds of behavior. But I'm going to do so through the lens of different kinds of pathology. And I'm going to start with the idea of pathologies in our likelihoods. So here in a continuous model, the likelihood distribution we might be interested in here might be just a normal distribution, some nonlinear function of our latent states, and some precision. So it's represented here as a precision, which is just the inverse of a covariance. As we said before, we can see the actual movement itself as being generated at the level of reflexes. And this is the same slide I showed you before, which, assuming a Gaussian distribution, those reflexes, or sorry, that prediction of this term is just going to be this quadratic term here with a nonlinear function, g. The tilde symbol on top of each of these variables is designed to show that we are now working in several orders of motion. So we're dealing with both position, velocity, acceleration, and potentially higher orders of motion in order to predict short trajectories rather than just a point in time. That means that when we are trying to optimize this, so you can imagine if you take the gradient of this, it essentially just becomes a prediction error, which is exactly the subtraction of our prediction G from the incoming data Y to generate our action to resolve that error. Let's come up there. Oh yes, and that's just making the point that the precision now acts effectively as a multiplicative gain term on this correction process. Now, when we're dealing with these higher orders of motion, we can separate this precision out into 2 different parts. So one is just the sort of instantaneous variance that we associate with our prediction as to the data that's going to be coming in. But we also now have to take account of the various correlations between different orders of motion. So for instance, between my position and my acceleration. And that has an impact in terms of the smoothness of the noise that we're predicting. So if I give you an example here, we imagine, imagine one of these is just dealing with what the overall variance is. And the other term now is dealing with the smoothness of the signal, how autocorrelated it is with itself over time. And both parts are important in terms of how we predict our data. I'm going to give you an example here where we now change the parameters of this model, of this reflex model. And here we're going to assume now that data is very, very precise. And you can see that we end up with a much larger, I'll show you back again. So one reflex, and then when we make this lesion, a much larger, brisker reflex of the sort we might expect in someone who's had a spinal cord or an injury to part of their motor system. We can then make similar sort of manipulations with the smoothness. So here we've said, what if we overestimated the smoothness? What if we're getting much rougher data than we expected? And here we see an almost pendular-like reflex. We see something that oscillates, much like you might expect in a cerebellar syndrome when someone's damaged parts of their brain that are involved in the estimation of these kinds of fine movements. And just to show you that same issue again in a slightly more complex task. So here we've just got a reaching task where I have to move my arm to one of the different targets. And if we introduce that smoothness lesion again, you can see that we end up with this dysmetric overshoot and almost ataxic-like limb movements that, again, are very similar to what you might expect in someone with a cerebellar syndrome. So that deals with sort of continuous models that work at the level of movement generation. But now I want to talk a little bit about the sort of models we use when we're thinking about planning and deciding between alternatives. And here we're very much dealing with categorical this or that type decisions. So here we're now going to say our outcomes, and these are going to be categorical variables now, given our states and some likelihood probability matrix A, are going to be a categorical distribution. And then we have conjugate Dirichlet priors that we put on top of those transition matrices. Now, the learning rules that we end up with that by minimizing some bound on the negative log evidence effectively looks a lot like Hebbian updating. So here we just say that we increase our Dirichlet parameters by the whenever there's a co-occurrence of the outcome we're interested in and the state that generated it. So when I think I'm in a particular state and it's generated a particular outcome, we basically just increment by the degree of confidence in that. I'll show you two examples of a very simple way of this happening. So here we're just showing a dot in a series of different locations, and imagine this is our outcome. We're just interested in one state at the moment. And you can see it's just gradually accumulating and becoming more and more confident over time. The reason that we've got differences between these two simulations is that in this upper plot, we're starting from a position of relatively low confidence that the state of the world is uniform. Whereas in this lower plot, we're starting from a relatively high confidence state that we're in a relatively uniform state. And that's just changed by making the initial counts either very high or very low. And this is much like if you imagine that you flipped a coin 5 times in a row and you get 5 heads, you might think it's a biased coin. But if I were to tell you that before that you'd seen 50 heads and 50 tails, you probably would be less likely to attribute the 5 heads to being due to a biased coin, and you probably wouldn't change your beliefs as much. And that's the difference between these two plots. The reason I'm emphasizing this point so much is that if I'm seeking information out there in the world, then it makes much more sense to sample locations that look like this upper plot, where I'm going to gain lots of new information, compared to those like the lower plot, where I'm going to change my beliefs relatively little. And that becomes particularly significant for the following simulation. So here, what I'm showing you is a simulation based upon some of the neuropsychological tests that can be done at the bedside for patients with a condition known as visual neglect. So in visual neglect, patients often with damage to their right cerebral hemisphere can end up with inattention towards the left side of space, and they essentially just end up ignoring it. And one way you can test for that is to give people a piece of paper with a number of lines on it and ask them to cross them out. And in someone with spatial neglect, they may omit to cross out those on the left, not because they can't see them, but just their attention is not drawn to them. What I'm showing here is a saccadic version of that task. So I just have to cancel out each dot just by looking at it. And the plot of the sort of lower part here is just showing the way in which the visual stimuli are presented to this agent. So it's got 3 different resolutions it can look at, each of which reflects a different quadrant, and each tells it the density of dots at that point, either within the quadrant, the subquadrant, or the sub-subquadrant. And that's just to give it a little bit of a broader visual field and capture different spatial frequencies. But the key point here is that it's looking around, it's sampling each of these locations, it's updating its beliefs at each one, and there's effectively an inhibition of return, because once I've updated my belief in one location, I'm more confident about that than anywhere else. So there's no point looking back there yet until I've looked at every other location first. So the next thing we do is we lesion this model to simulate the spatial neglect syndrome. And so on the left, I'm just showing effectively the normal healthy model, and on the right, I'm showing a case where we've introduced a lesion. And the way we've introduced the lesion is we've said, imagine that I'm representing the different locations I could look to as the states I can choose, and the observations I make as being the visual outcome, whether I see a dot or not when I look in that location. Then my likelihood is just the prediction from that S to that O, here represented as the sort of the connectivity between the front and the back of the brain. If I lesion that effectively means that there is now no connection on that side to optimize. So that's effectively saying I'm very, very confident that there is no association between these things. The Dirichlet counts are essentially now at an almost infinite level, because I can't update. I won't learn anything new by looking towards that side of space because there just aren't the connections to even update anymore. And so we've done that for those connections reflecting the left part of space that we'd expect to find in the right hemisphere. And you can see here that effectively this system now just completely ignores the left side of space. There's no point looking over there because there's more I can learn by looking to the right. So that covers a couple of different points in terms of likelihood distributions and two different sorts of model that we tend to use. The next thing I'd like to talk about is just some simple pathologies associated with prior beliefs. And I've already said that we tend to use this expected free energy prior, this idea that I'm going to maximize my information gain while also maximizing any sort of reward or utility I can get by complying with my preferences. And I've just added in a little softmax parameter here that allows us to manipulate how effectively we're doing that. So if I now take my prior belief about my policies, and again, I deal with this sort of movement task where I have to select which location I'm going to move to, I can then introduce a lesion to this by reducing that confidence. And you can see that the result of that is a very, very slowed movement, very difficult to get started, difficult to initiate, and it's unable to really make a decision about where to go. And we could see this as being like the sort of disorder you might get with basal ganglia pathology, and particularly thinking of things like Parkinson's disease and bradykinetic disorders. There are a number of other things other prior beliefs that can become very significant. So what I've done here is I've just equipped this prior belief over policies with both an explicit mention of our preferences. So here we have how strongly or where I think I'm going to get the most value, and this E term here, which is effectively just going to be a fixed form prior, effectively like a habit. So it's going to say, what do I tend to do in this situation, ignoring all of the context? And to illustrate the effects of this, I'm going to use a Stroop task, which probably many people are familiar with. So the idea is that if I were to ask you to read the words here, you would probably be able to do so quickly without any issue. If I were to ask you to name the colors of the fonts, you'd probably also be able to do that in this case very quickly without any issue. However, if I now asked you to name the font colors here, it would probably take you a little bit longer because there's now a disconnect. And the reason for that is clearly that you're much more used to reading words than you are to naming the colors that their fonts are in. So you've got a very strong prior belief that when I'm presented with a word, what I tend to do is read the word and not name its color. So we wanted to use this as a way of demonstrating these different sorts of prior terms and their influence. So this is effectively the structure of the generative model that we used. So at this higher hierarchical level, at a very slow level, dealing with each word presentation, I either believe I'm being given an instruction or supposed to be giving a response. And the instruction can either be to read the color or the written word. And then I have a response modality, which is the thing I have some control over. I can select policies to choose which modality I respond in. Then we have the sort of faster scale that just deals with, during that word presentation, what are the steps I go to actually make my response? And here we've got a fairly self-explanatory set of descriptors of what's actually being shown and the response modality again. We also have this belief about whether I was correct, incorrect, or whether that's irrelevant to this current stage of the task. This does not actually have any data that's given, so there's no point where we tell it whether it's right or wrong, but it maintains beliefs about whether it or not it is, based upon the combination of things at the higher hierarchical level. And then finally, we have the observations that we're actually presenting to the model. And so this is just a simulation showing the behavior of the model presented with this task. So it's given an instruction, in this case, to read the words, and you can see that it's doing that very effectively. I thought on this side, I won't go through all of these in detail, but this is the simulated interpretation of the belief updating underneath that in terms of physiology. The key one to look at here is there's a big difference between whether I believe I'm going to produce the word reading versus the colour naming policy. If we now change the instruction, you can see, first of all, that becomes much less confident. So now it's much harder to work out which policy I'm pursuing. And the reason for that is that I have a strong prior belief that goes against the instruction I've been given. I tend to read the word and I'm being told to name its colour instead. And you can see that although it still performs relatively well, you'll see when it gets to this point that it does start to make errors at this point. And we can reproduce some of the sort of simple behavioural and also electrophysiological type responses that we might expect. First of all, from the behaviour itself, but then also looking at the belief updating and the rates of change of that and interpreting those as depolarizations and evoked responses. So here we actually end up getting a much larger evoked response to congruent versus incongruent stimuli, where the congruent stimuli are clearly much less ambiguous. We can sort of do various things like map those parameters onto different behavioral variables and work out what we would predict based upon that. And we can even use simulated data and try and recover the parameters that we use to generate it. So here we're trying to recover both our preferences or how strong our preference for being right was, and how strong our prior for reading words is. And we've just simulated a whole series of data sets and fit those models. So you can see it, the red dots are the true parameters used to simulate the data set in question, and the bars are our inference about what generated it. You can see it's not perfect in terms of being able to recover this sort of strength of this habit for reading, but it maintains that sort of rank order. We are able to recover relatively well the strength of our preference being right. And crucially, we can actually get the difference between these two recovered pretty well just from these behavioral data. The point of showing that is that it's one way in which these models can be useful in terms of phenotyping individuals, particularly thinking again in the clinical domain. If you were to use a neuropsychological battery of tests and record the responses, then you might be able to actually use that to provide a quantitative phenotype of these individuals that can actually be used to simulate their behavior and potentially look at response to treatment. So I'm now going to talk just briefly about hierarchical models. So this is where we now add a depth to that model. And these equations here are just showing how we're dealing with a particular kind of deep model, one in which we combine both the discrete categorical sequential models we were dealing with earlier with the continuous movements that we were generating as well. So the idea here is that if I have my categorical outcome from my discrete model, I can then associate that with some normal distribution over the priors of my continuous model. And so I can treat each discrete time step as reflecting a set of effectively Taylor series coefficients that tell me what my short trajectory is going to look like. And so I can then piece together more complex movements from those series of short trajectories. And again, this is exactly the same principle that we might use in a Gaussian mixture model, where you associate discrete states with some continuous space. This equation here is just showing message passing back in the other direction. So here we're now passing information or forming belief about the discrete outcome based on the inferences we arrived at the sort of Gaussian continuous level. And I've already shown you this example of a generative model generating eye movements. If we were to take that generative model and put on top of it one of the discrete, so here we have a series of discrete outcomes up here, each of which is now predicting a short sequence of movement at our continuous level. And we've got three of these segments corresponding to each of the three outcomes. And at the bottom here, we've then got an interpretation of message passing that would solve that generative model. Thinking neurobiologically again, we can take the model that we had for the message passing up here, and these are the same filtering equations we were using before. And we can then just plug in the beliefs we might have about which saccade we're going to make. And when we do that, so here are several different policies I could choose, the time steps at which I'm going to choose them, and the errors that might be represented somewhere like the superior colliculus, mapping us from that discrete continuous domain, with those errors now being resolved by the eye movements themselves. And we're not restricted to eye movements, and this is where the task that I showed you briefly earlier comes in. So here we're now dealing with several hierarchical levels for a model of arm movements. And the idea here is that we've got a slowly changing context represented by our top level, which is which of these three targets should I be aiming for at this moment in time. We then have a model which says which sequence of arm movements am I going to make in order to reach that target. And then that feeds into a model that predicts the joints and the angles of the joints at the level of the arm itself. And I've already shown you sort of successful performance of this task. Again, we can sort of interpret this message passing in terms of the way it might be implemented in the brain. And you can see it performs this task relatively well. I'm going to show you what a hierarchical lesion to this would be, where we now essentially break the link between higher levels of the model and lower levels. So this is now dealing with the distinction between very slowly changing contexts and the plans that I then make, and how well I can sort of construct my motor narrative. And you can see here that it's able to do all the low-level movements relatively well, but every time the context changes, it takes much longer to be able to deal with that change of context and adapt to the new task. It's almost perseverative in that it takes a while every time you've got that change to say, no, things have changed, I'm going to do something different now. With that, I'll just sort of say, you know, we've sort of started from this idea of our brains using models to then, via a sort of Bayesian method, update our beliefs about the world around us. Once we interpret that in terms of a model with reflexes, we can then use our models in the way we believe our world to be to generate actions, optimizing exactly the same objective functions. And then we can deal with simulation of sort of curious behavior, autonomous behavior of various sorts, that then map directly into a motor domain and generate continuous time series. So thanks to a large range of people, probably many of whom I've missed off. And thank you everybody for listening.